Ask the Experts platform is a monthly segment that offers an opportunity for Namibian journalists to engage noted experts in one-on-one discussions on the COVID-19 pandemic. Journalists get to pose questions to experts in various sectors to ensure that they are equipped with the necessary information to better inform their readers, listeners, and viewers. COVID-19 is our common enemy. Together, we can defeat it. Proudly brought to you by the Namibia Media Trust and the DW Academy.
Welcome to another session of Ask the Experts. I am going to be your moderator this morning. My name is Nina Katangana. We're also joined this morning for the first time by sign language interpreter Selma Moses. Selma, good morning and welcome to you. Thank you so much for joining us. It's so nice that we're reaching way more Namibians this morning by having you here. Now, this platform is obviously made possible to discuss COVID-19 matters and COVID-19 related issues. And if you'd like to catch some of the previous hashtag Ask the Experts conversations, they are up on the Namibia Media Trust YouTube page, so you can go back and have a look at some of the previous conversations that we've had thus far. Or you can also just search on YouTube hashtag Ask the Experts, and then those conversations will pop up. Today, though, we will be talking to our expert, Dr. Hong, who is the chief of the clinical branch for the CDC of Namibia. And we will be speaking to him this morning about COVID-19 vaccines and also around other related matters and herd immunity. So Dr. Hong, good morning and welcome to the platform. Thank you so much for taking our time to speak to us today.
Good morning. Thank you so much for having me on your program. Appreciate it.
Now, Dr. Hong, I understand that you've been in Namibia for about 4 years now. Just to start off our conversation, perhaps you can tell us, how you find the country.
Well, I've actually been working in Namibia since 2009. Really living full time here for the past, 6 years, over 6 years. I always measure that by, I got to remember how old my son is. He's 7, and we brought him over here when he was about 6 months old. So he's basically grown up here as a Namibian. So yeah, I consider Namibia my home. And I've really enjoyed being here. I love the people here, really amazing people in Namibia, very warm, very friendly, very helping of one another. And so, yeah, I do consider, I'm from the US, from Chicago, but I really enjoy living in Namibia and I really consider it my home now.
That's awesome. Now, from your professional standpoint, Dr. Hong, I just want you to paint a picture for us on the COVID-19 situation in the country.
Yeah, so right now, as everyone knows, Namibia is in a crisis situation where we're right in the middle of a third wave. And so Namibia's government has responded very well up till now, really getting the country prepared in every possible way, from prevention measures to case management, messaging, etc., just protecting its people. However, the measures are in place, but nobody could have really anticipated such a huge rise in cases in the third wave. And in my mind, the third wave, it's not really anyone's fault. Of course, there's measures that could decrease the amount of spread, but what's happening is we're seeing a wave of infections happening all across Southern Africa. It's not just Namibia. You see it in South Africa, you see it in Zambia, in Botswana, Zimbabwe. All these countries that are surrounding Namibia are all experiencing the same thing. And what experts believe, it's really due to different variants of concern of COVID-19. And in particular, we're thinking of the South African variant, the Beta variant, and also the one that originated from India, the Delta variant. Delta variant has been shown to confirmed within all the countries that are surrounding Namibia. But this Delta variant has been found to be much more transmissible than the original variants. And as you can imagine, if you have kind of like a fence of protection that's set up against infection and death, and then it's been kind of good enough for the virus that has been coming up against it. Now you have a new virus that's much more transmissible. So it's like a wave coming over it. And so it's a difficult thing right now. This Delta variant is not just more transmissible, but it's been probably shown to be more virulent, causing more severe illness and death. So, this is something that we have to be very mindful of that's happening right now in Namibia. And the things that we've learned to do over the past year, things like proper masking, proper distancing, hand hygiene, ventilation of your room, these kinds of things, they work, and we need to practice them actually even better than what we used to in the past, because now it's actually almost a different disease. The Delta variant is almost a different virus. It's the same virus, don't get me wrong, but it's much more transmissible, and we have to be much more on top of our game in terms of preventing it. And vaccination, obviously, we're going to talk about that now. Vaccination is so much more important now that we're getting these variants coming up.
You also said that we are currently in the third wave. I want to know, how do we classify a new wave?
So if you take a look at the number of cases, people do it differently. And there's different measures. You can do it straight out by number of cases, in comparison to before. You can do it by cases per 100,000 population, that's the rate. You can also do it by the percent positivity of testing. So amongst all patients that you test, what percent of them are positive? And those are different measures that you can use. You can also do by the trajectory of the cases. Are you going up or down? And so we use all those different measures to classify whether we're in the third wave or not. And it's very clear right now in Namibia that we are. No one would dispute that at this point. The third wave right now, if you look at the curves and the numbers, we are far exceeding the first and second wave. It's not even on the same chart. So when will this end? We don't know. I mean, in general, we've seen in Namibia and in South Africa and other places, these waves have been lasting about 3 months. And so they don't go on forever. That's the good news. They do not go on forever. They do eventually come down. But we don't know, with the potential of a new variant here and new infection dynamics, we don't really know how long this wave will last. And the important thing is, when I say they don't last forever and eventually the cases will go down, that's true. But the aftermath, right? The aftermath of a wave, all the sickness and deaths, that's what's important. And it's really concerning for me and other people in the task forces and the pillar responses in the ministry. We're very concerned about all the deaths and just the cost to human life and people's families. And so, yes, we do, there is hope that, the wave will come down eventually, but we just need to do everything we can right now to decrease human loss. So the question is it correct to assume with a new wave, there is a new strain? That's a very good question, Nina. And, there's different things that contribute to the different waves. One thing is measures, right? The public health measures like distancing, cutting down on numbers of people gathering, indoor dining, these kinds of things, public health measures that the government puts into place for the good of the people. I think these things contribute. When these measures are loosened, it seems that then that leads to resurgence of these waves. That's one thing. The other thing is it may be seasonal as well, right? We've seen that the SARS-CoV-2 seems to be seasonal. In winter time, it seems like the cases surge. We saw that happening in the US. We see it happening here in Namibia as well. So that may be one thing as well. Like we're in winter now. It's very, very cold. And my house is extremely cold. And because of that, people stay indoors more. And we know that SARS-CoV-2 spreads better indoors because it's spread through the air and droplets. So those are the two factors. The third factor is the potential for a new strain. And so if a new strain, as I said before, is introduced into the population that's much more transmissible, then that may lead to increased numbers of infections and deaths, et cetera. So yeah, I think it's not simple just saying it's a new strain. It's probably all these three things, maybe other factors involved. But when I look at Namibia's waves, it does look like the first wave came, with the wild type strain, the original strain, and then the second wave did come somewhat coincidentally with the introduction of the beta variant, the South African strain. And so my prediction is that the third wave is probably coinciding with the introduction of an additional strain, potentially a Delta variant. I don't know for sure. We have to see the data, but if I were to guess, that would probably be the case.
All right. We're currently in the 3 months, I think, into our national vaccination rollout plan. What do you have to say about, the uptake?
Yeah, so thanks for that question. I think with any vaccination campaign, it starts a little bit slow. You see that in the US, you see that in other countries. But then you start to see ramping up of vaccines uptake. And that's what we see here in Namibia. We do see, if you take a look at the curve that shows where, in terms of the numbers of people being vaccinated every day, we see that Namibia it's on the uptick, that we're seeing a lot more people now getting vaccinated. Now, that may coincide with a lot of different factors. One is that we're in the third wave and a lot of people are now getting vaccinated out of fear. And fear can sometimes be a good motivating factor. And so we see that happening, but not only that, the National Vaccine Task Force has really done an excellent job of getting the message out to people through social media, through other avenues, through personal engagement with people, through meetings, with religious leaders that happened not too long ago, to hear people's concerns and questions. We've been doing this really every other day. We're having these meetings with people that we work with, organizations, answering all their questions. Because these are legitimate questions. There are legitimate questions that people have before they get vaccinated, and there are answers to these questions. And so I think in terms of where we are, the country has done a really good job of trying to scale up vaccination, and you can see that out of the 197,200 vaccine doses that Namibia has received thus far, we've almost run through them. Actually, I think we're maybe like 150,000 doses given out. So I think in terms of being able to use the doses we have, we're not wasting them, we're using them all. The good news is that the government has stated that new orders of vaccines are coming in. I think probably around over 500,000 doses are scheduled to be coming into the country in July. So that is really, really great news that we're going to get these vaccines very soon. And my hope is that the increased uptake of vaccine uptake is going to continue to go up, that we won't go through any downs of that, but as vaccines come in and the numbers of people getting vaccinated go up, that it will coincide and that we can really get closer and closer to herd immunity.
With that said, Dr. Hong, I don't know if you have some stats that you can share in terms of percentage, to give us an idea of how many Namibians currently, are vaccinated, are getting vaccinated, or have been vaccinated.
Yeah, so the latest data that I see, let me just share this with you. In terms of first doses, That's 118,154 doses given, and that is a combination of the Sinopharm vaccine and the AstraZeneca vaccine. And then amongst the second doses, we see 23,662 doses that have been given out. That's, if you combine that, that's 141,816 doses. In terms of what percent, that constitutes 4.7% of the total population, and 4.7 and 0.9% of the total population, and 7.9% and 1.6% of the targeted population. So the targeted population are the adults, really, because the vaccines right now are authorized for use in 18 and above. So those are the targeted population who are eligible to get the vaccine.
With those figures, I mean, it's 4.7%. You know, one could argue that it's quite a low figure, which then, you know, leads me to ask, you know, what is going to take for Namibia to reach, number one, herd immunity, and then secondly, can we sort of predict how long that may take based on the current speed at which Namibians are being vaccinated?
Yeah, that's such an important question. Yeah, in terms of the entire numbers, it's low right now, and it's not specific only to Namibia. You do see countries, richer countries, have a much higher percentage of their population vaccinated. Right now, most of the countries in Africa are very, very low percentages like we are. But, you know, honestly, though we are lagging behind, we do have a glimmer of hope because the vaccines are starting to come in larger numbers. And so that would be the hope. I've read in newspaper stories like someone calculating, if we continue at this rate of vaccination, we'll reach herd immunity, which is 60 to 80%. We don't really know what percentage will be for SARS-CoV-2, but it's probably somewhere within 60 to 80%, right? So like where they get that is influenza is about 60%, measles, which is the most highly transmissible virus, is about 95%. So SARS-CoV-2 is probably somewhere in between that. That if you go at this vaccination rate, we'll reach herd immunity in like 4 years or something like that. But that kind of calculation is really not fair because it's not a straight line, right? In no country is vaccination rate uptake a straight line. It's really more like you start off slow and then you really ramp up and you go to a huge peak of numbers of vaccinations. So that's what I expect for Namibia. I do expect that once we get the vaccines in the country, that the vaccine task force will really go into high gear, and and once we get this thing figured out and we have the doses, the supply is given, then we will match giving out the doses with the supply that we have, and very, very quickly.
All right. I'd like to touch a bit on the two vaccinations that are currently available in Namibia, which is the Sinopharm and the AstraZeneca. I just want to go through the characteristics of these two vaccinations. They serve the same purpose, but they're not exactly the same. So perhaps you can just give us the characteristics of the two different vaccinations currently.
Let me just start off by saying both vaccines, Sinopharm and the AstraZeneca, are both WHO approved, approved by the World Health Organization. And when I say that, that's an important statement because the World Health Organization goes through a very vigorous look at all the data that are available for safety and for efficacy. Not only that, they actually go and do site visits of the manufacturing place. So this is not just sitting in an office and looking at data, that's part of it, but also going there and seeing how it's being done and checking it out. So I think that's important to know that when I say that they're WHO approved, there's a lot that goes into that. So Sinopharm, this is a vaccine that it's an inactivated whole SARS-CoV-2 virus vaccine. And so when I say inactivated, that's important. So basically, this vaccine does not have any live virus. So that's one fear. Like people think, oh, am I going to get COVID-19 through the vaccine? No, it's not possible. It's an inactivated virus vaccine. It's given 2 doses, 28 days apart. And there were a large trial with over 40,000 participants that was done. There was a phase 3 efficacy trial. These vaccines go through phase 1, phase 2, phase 3, and it's gone through all the phases of vaccines that the kinds of studies that we do for all vaccines. And what it showed was that 14 days after the second dose, so you're not considered fully vaccinated until 14 days after that second dose, it showed to be 79% effective against symptomatic infection and 79% effective against hospitalization. So that vaccine Sinopharm has been shown to be very, very good. And likely the efficacy against death is much, much higher than that. And the second vaccine is AstraZeneca. And this vaccine is also approved by the WHO with emergency use listing. And it's got a different platform. It's based on a replication incompetent adenovirus. And so it's another viral vector. Again, no live SARS-CoV-2. You cannot get COVID-19 through this vaccine. And what it does is it expresses the spike protein. This is all the COVID-19 vaccines so far really express the spike protein. That's kind of like the spikes that are studded around the SARS-CoV-2 virus, and allows the body immune system to recognize it. The phase 3 trials for the AstraZeneca, this was done in multiple countries. The first phase 3 trial was done in the UK, Brazil, and South Africa. And then the second was also done in the United States of America. The US study showed 76% efficacy against symptomatic infection. And so both these vaccines are very, very safe. They should be given to people who are 18 and above. There is no upper age limit. So that was a little bit of a confusion at first, but it's been clarified that really, if you're over 60, over 65, 80, 90, 100 years old, you should get these vaccines. And actually, you're the ones who are at highest risk to die, get severe disease and die. So these vaccines are for them as well.
Yes, that's it. Dr. Hong, a concern that there is from the public, and being, a citizen myself, and that has had a lot of sort of discourse around vaccinations. The general, or my general sort of takeaway is that the majority of Namibians, or rather a large sum of Namibians, are still very fearful of getting the jab. And I sort of relate that to just not being well informed and, having a lack of knowledge around the vaccines and its purpose. And one of the concerns that there is from the public is that, once you've already been vaccinated, you can still get the virus. And so people are saying, what's the point?
Yeah, good question. So I do understand people's fears. It's something that, you don't want to discount that. And I think a lot of the people are afraid because people are afraid of the unknown. But, honestly, vaccines have been around for a very, very long time. And people have been getting multiple vaccines. They've been studied very well, and they've been in use. I don't know how many vaccines I've gotten in my life, and I'm alive and healthy. And I've gotten SARS-CoV-2 vaccine as well, fully vaccinated, and I'm doing fine. And not only that, I think about 3 billion people have gotten vaccinated with COVID-19 vaccines so far. That's saying a lot. Yes, look here. No, I'm looking at the numbers. 3,6,860,439 vaccine doses administered. That's a lot of vaccine. And so, people are not, their DNA is not changing. They're still human beings. They're living, and they're doing fine. In actuality, if you take a look at the countries that are well vaccinated, you can see that their COVID-19 curves have come down. And case in point, in the US, you see where they vaccinated over 50% of their population, that they even got rid of some of their mask mandates because the cases are down, the hospitals are empty. So, yes, if you fear the vaccine, a lot of it's unknown, a lot of it's, misinformation. There's been so much false news and misinformation going around about these vaccines. And it's really disturbing, actually, that people would say those things, because it really leads to people having more fear and not getting vaccinated and not getting a vaccine that could actually save their life. When you look at all the deaths around the world, and let's see how many deaths have been around the world. 3,937,978 deaths so far. And in Namibia, you see the numbers of deaths every day. Every single one of those deaths is potentially avoidable with vaccination. So why should we get vaccinated? Why bother if it's not 100% effective? Yes, vaccines are not 100% effective. They're very effective, but they're not 100% effective. Some people will get infection, but very few of them. But the good news is that if you get infected with SARS-CoV-2, having been vaccinated, the chance that you are going to get very sick, need oxygen, and be hospitalized and die is very, very low. And that's a proven fact all around the world. So vaccines are not just to keep you from getting an infection. Vaccines are also, and more importantly, there to keep you from getting very sick and dying if you get infected. We do that all the time. I'm an infectious disease physician in the US, and we give influenza vaccines, a flu vaccine every year to all of our patients. Why do we do that if they're only effective like 50%? Because we know that if our patients get influenza vaccination, if they get the flu, they will not get very sick from the flu. And we do that especially for our elderly patients and those who have comorbidities. And so that's been a normal practice for us for a long time. It's the same for the COVID-19 vaccine. So so the message is get vaccinated, because even if you get COVID, the likelihood that you're going to get sick, very sick from COVID is very, very low. Also, just to give you an analogy that's in my mind, if you say, seatbelts, why do you need to wear a seatbelt in a car? I mean, they're not 100% effective. If I get into a very bad accident, people who have died who've had seatbelts on. So is that an argument not to wear a seatbelt? Nobody would say that's an argument to not wear a seatbelt, right? You still want to wear a seatbelt, even though it's not 100% effective to save your life, but it will save many lives. And it will save you from a lot of injuries, not just death, but it will save you from breaking your face in when you hit the steering wheel or the windshield and needing plastic surgery on your face. So honestly, vaccines are not 100% effective, but they're very effective. And they do provide excellent protection for death and severe infection. Over, thanks.
I'd like us to talk about immunity, and Hatutale also had asked the same question that I had prepared for you. And also for our participants, if you do have a question for Dr. Hong, please just put it in the chat, and then I'll filter it through to him on your behalf if he doesn't read it himself. So on immunity, Dr. Hong, individuals who have had COVID-19 now have natural immunity. That's how we understand it, which has been built up due to the antibodies, which have developed in their bodies from the virus. My question is, how long does this immunity last if you've had COVID-19? And I also want to know, how long does the COVID-19 vaccine immunity last against the virus? Because from what I understand, the WHO to date has not been able to say that you could be lifelong protected, or if just for a few years. So just to compare the two, talk to us about immunity.
Thanks, Nina. Let's talk offline about the analogy. No analogy is perfect, of course. And so if you don't like that one, I won't use it again. But I think the point is valid. So how long does the immunity last? How long does natural immunity last? How long does vaccine immunity last? That's a very, very important question, which I honestly, I don't think anyone has a definitive answer on that. But there's some data that give us some pointers. Some of the studies have shown that natural immunity lasts at least for about 6 months, probably longer. And vaccine immunity, some studies have pointed to lasting at least 8 months, probably longer. And so is it really only going to be that short? I don't think so. Most experts are now thinking that vaccine immunity is going to last much longer. Some people are thinking in the years, maybe at least 1 to 2 to 3 years. And the reason is this: it's because what we do when we look at the efficacy of a vaccine and how long the efficacy lasts, we look at what's called antibodies. So your white blood cells, called B cells, they produce what's called antibodies. And these proteins or antibodies that your immune system creates attaches to the virus and kind of surrounds it and helps to destroy the virus. So, so these antibodies, you can measure them, these neutralizing antibodies. And what they do is they see that your antibodies kind of spike up when you get the vaccine or when you get an infection, and they slowly come down. And so what they do is they measure how long until they come down. But nobody knows really at what level of antibodies that you're actually protected from infection. So it's kind of a guessing game. But we do see that they come down, but they come down slower. What we've seen is, but it's not, your immune protection is not just from antibodies. There's also called cellular immunity. Your T cells are also in action and going to be fighting the virus, and things like memory T cells. So we think, and so your immune system remembers how to make those antibodies. It remembers that antigen or that virus. And so later on, maybe a year after, maybe your antibodies are lower, but then your memory cells remember it. So then they see the virus again, and they'll quickly go into action and produce antibodies. So most scientists now believe that the vaccine will probably protect you for longer. Now, people always ask the question, if you've gotten the natural infection, aren't you immune? Why do you need to get a vaccine? Well, we think that when in terms of the studies that have been done, it seems the immune response for somebody who has a natural infection and thankfully recover and not die, they do have some immunity. But then if you add vaccine to them, that their immunity will last probably much longer. And we've seen in the studies that the immune response that's generated by vaccines is even higher, actually, than the natural infection. So yes, so people who've gotten natural infection, we do recommend they get vaccinated to make sure that their immunity lasts for longer and it's more robust and able to take on all the different variants that are coming along. Hope that answers your question, Nina.
Yes, perfectly. Thank you so much, Dr. Hong. I do have a question from you, from a member of public around getting the vaccine. She says that she's a breastfeeding mother of a 4-month-old baby and wants to know if it's safe to take the vaccine, and if the answer is yes, which of the two vaccines would be best suitable for her. And after you've answered that question, I'd like Valerie Pack to please just unmute your mic and then ask Dr. Hong your question directly. But that's the question, Dr. Hong, that I have for you from Etuna.
Okay, so the question is, a mother of 4, should she get the vaccine, and which vaccine? Is that correct?
Yeah, her baby is 4 months old and she wants to get the vaccine, but because she's breastfeeding, she wants to know if it's safe to get the vaccine, and if your answer is yes, which of the two is most suitable for her?
So great question. So that's along the lines of the pregnant women as well. there's always questions about that. Is it safe for pregnant women to get vaccinated? And the answer is yes. All the information and data we know for pregnant women is that these vaccines are safe. And we've seen a lot more data coming out that really there have been no really adverse reactions or things that would contraindicate someone pregnant from getting vaccinated. In fact, pregnant women are at higher risk of developing severe infection and dying, so they should get vaccinated. Breastfeeding women as well, there's no contraindication. It's safe for breastfeeding women to get vaccinated. In fact, it may be beneficial because you know that one of the benefits of breastfeeding, other than the fact that it's good nutrition for your baby, is that when you, this is good data on this, that when you breastfeed your infant, you give them immunity. So the things that you are immune to, mom, you give your immunity to your baby. And so that's very, very important. And there's some data showing that some of the antibodies for SARS-CoV-2 for the COVID-19 infection are transferred over to the baby. So that may afford some protection for the baby from the mom, which is a good thing. And so I would recommend it, a vaccination for the mom if they have an infant, for sure. Which vaccine amongst the ones in Namibia? Both of them are fine, and there's no contraindication. There's no issue with either of them. You can get the Sinopharm vaccine, and you can also get the AstraZeneca vaccine. Whatever is available for you, I would get it.
Thank you, Dr. Hong. Valerie, if you pose your question to Dr. Hong directly, and then after that, Clavert also has a question. So Clavert, you can go right after Valerie.
Good morning, Nina. Morning, everybody. Good morning, Dr. Hong. Thank you so much for this opportunity. My question is actually regarding the Sinopharm jab. Like I mentioned to Nina, I got my first jab on a Friday. And 4 days, let's say on the 5th day, I tested positive, or I started having some symptoms. And then that Thursday, I tested positive for COVID. So now my question is, do I go for my second jab? And if I do need my second jab, the next question is, how long after my recovery do I go for my second jab? Because my question is then, how much of this virus do I need in my body in order to be immune?
Valerie, thank you. That's a really great question. So my interpretation of what happened to you is you got your Sinopharm vaccine, and then 4 days later you were positive. Why did that happen? Because you were probably infected maybe before you got the vaccine or right around the time when you got the vaccine, and there was not enough time for you to develop immunity. Right? Remember what I said was you're not fully immune until 2 weeks after the second dose. You do have some immunity 2 weeks after the first dose, but it's not complete. So, but your body just did not have enough time to develop immunity to getting the infection. I'm so thankful that you're fine and that you recovered. You're one of the lucky ones who are able to recover from an actual infection with COVID-19. Now, when should you get a second dose? Yes, eventually. When should you get it? The government recommendation right now is you should get it. The earliest you can get it is after you are well and you've de-isolated, and that's usually about 14 days. That's what I've seen quoted in the circulars. However, you are well protected right now. You've gotten 1 dose of vaccine, and you've gotten immunity from a natural infection, and so I would say you are very well. You're one of those lucky ones who are well protected from COVID-19 right now. And so I would say the earliest you can get it is 14 days after you've recovered from natural infection. Actually, 14 days from the onset of your natural infection, which is when you could probably de-isolate. That's number one. Number two, you could opt to wait as well. You know, early on, governments were saying don't get vaccinated until if you've got it, if you were infected, don't get vaccinated. Give yourself 6 months and then get vaccinated. So that would be an option as well. But anytime from 14 days on, you can get vaccinated. Hope that answers your question. Is that clear?
Yes, it does. Thank you so much, Doc.
Thank you so much. Clavid also has a question. So Clavid, if you are ready to ask Dr. Hong your question, please do go ahead.
All right, thank you very much. Good morning, everybody. Good morning, Dr. Hong. Nice to see you again. Last time I saw you was in 2020. My question is, after being diagnosed with COVID-19, say for example, I had COVID-19 and I recovered. What are the chances and how soon? What are the chances of getting COVID-19 again after recovering from it? And then also the second one is, how long do I keep testing positive after recovering from COVID-19? How long does the virus stay in my body again? Reason why I'm asking this last question is because there are in some cases, and I'll refer to myself when I had it, and when I got discharged, I was told that I'll probably have to test positive again because I got discharged. But fortunately, it's a good thing. I had to travel, and then I had to get my COVID test, so I tested negative. But in some cases, you hear people who are still testing positive after they had COVID-19. I think even His Excellency, the President, even mentioned that he was still testing positive when he was talking about his recovery. Thank you.
Great question, Clavert. So that's something that we've learned way at the beginning. You remember when in the beginning of the outbreak in Namibia, we used to follow people and keep them isolated until they tested negative. And what we learned very quickly was that people take a long time to get negative. I think the first couple that was tested positive here in Namibia, we followed them out like 3 months and they were still positive. But you know, with more data, it's come out that what they do is you can continue to shed the virus. That means you continue to have virus coming out of your respiratory system for a long period of time. That can happen. But what they've shown is that if you take, are they live virus? That's the key. Are you shedding dead virus or live virus? And the way that they could tell is they culture it. So they try to grow it, right? You can't grow and reproduce unless you're alive. So what they do is they grow it in the lab. And what they found is that really after about 10 days, you cannot isolate live virus. So you're not really, and you can't get infected by a dead virus. You can only get infected by a live virus. So after about 10 days from onset of infection or your positive test, you're not gonna really have any live virus. So that's why we say after 10 days, you can de-isolate. Now there's some exceptions to that. They've shown in more data that people who are severely infected, who have to be in a hospital, who are on ventilators, people who are immunosuppressed, those people, if they get SARS-CoV-2, some of them, not even a lot of them, but just a minority of them may continue to be infectious for up to 20 days. But that's a very minority of them. So yes, so that's why those are the data that guide the de-isolation. But yes, your answer is, what you said is correct. You can continue to shed virus, but after about 10 days, that virus is not living anymore and you're not infectious. The other question you had was, what is your chance to get infected again from COVID-19 after you've been infected? That's very, very low. As I said before, it can happen. We've seen very rare cases of people who were infected after recovering from COVID-19, but it's very, very rare. And secondly, why would it happen? It's possible that your immune system just did not develop the robust immunity as others do. And you may be an immunosuppressed, you may be on immunosuppressive medicine, whatever it may be, you may have comorbidities, whatever it may be, you may not have developed a robust immune response to that. It also may be due to variants. So as I talked about at the beginning, there are these COVID-19 variants. And so their data have shown that sometimes people who have been infected with one strain and recovered can get infected with another variant because even after that. That's why we advocate vaccination, because then your immune response is much more robust and able to handle the different variants. But natural immunity has been shown in the data that I've seen to last for at least 6 months and possibly longer.
Well, thank you, Dr. Hong. That was very informative. Before I give the floor to Rio to ask his question, which is also a very interesting one, I wanted to know, you said that after about 10 days, you start shedding dead cells of the virus, so you're not really, contagious anymore. And so you could test positive if you went for a COVID-19 test, but that's because you still got the dead cells of the virus within your body, and that's what you're shedding. I want to know if after 10 days you're sort of, assumed to be in the clear. A lot of people have said that they've, gone into isolation and it's a month, 2-3 months later, but they still have COVID-19 symptoms. So not very severe, but they're still coughing, they still feel, have a tight chest, some may still have fever. Why does that happen? Because it seems that these symptoms still linger very long after the time frame that you assume to be, COVID-19 negative.
Nina, thank you for that question. It's really important for people to know that. SARS-CoV-2 is an acute infection, meaning it happens and then you either die or you recover. And we said that the 10-day period of de-isolation. However, it's been very, very well described around the world, something called long COVID, okay, or post-COVID conditions. Very, very well described. What is this? It's people who get better and recover from COVID-19 infection. And so they're not actively infected anymore. They've recovered. They're not infectious anymore. But they continue to have symptoms like weeks, months, even like 6 months later. There's been some studies that 6 months later, like half the people have some of these, at least one of these symptoms. And so some of these symptoms are things like, physical problems, like still having difficulty breathing, having fatigue, just feeling tired, continued loss of smell and taste. That is not a pleasant thing. I've heard. That's never happened to me. I would hate to lose my sense of smell and taste and not be able to taste food. But I've heard that it lingers in people for months. Difficulty breathing, coughing lingers for weeks and months, heart palpitations, difficulty sleeping, dizziness, your mind, your memory is not good. I actually saw a study that when people, they did an MRI of people's brains who have been infected with SARS-CoV-2, and they actually showed that people with SARS-CoV-2, some of them actually had decrease in parts of their brain. And some of it was in places where they would store memories. So it's really interesting. This long COVID or this post-COVID condition seems, there's different percentages quoted. I've heard like 20-30% of people having this. So it's not an insignificant thing. It's not that, oh, I'm not going to die from COVID-19, so I don't need to protect myself. I need to get vaccinated. That's not true. It's not just death. We're talking about illness that could linger on for months and months and months. And some maybe not even get better for the rest of your life. So I would just be very careful about this. So thanks for bringing that up. A lot of people don't know about that. They don't talk about it, but they need to know about it.
Yeah, 100%. That is a conversation that needs to be had more about the long-lasting after effects of the virus on your body and how your health is altered, long term, or sometimes even for the rest of your life. So perhaps we can have another conversation about that on this platform at some other time. Rio has a good question. I think Hatutale's question is the same as Rio's, basically. So Rio, if you're ready, then please ask your question to Dr. Hong directly.
Hi, yes. My question basically is, if my first jab was Sinopharm, should my second also be the same, or can I switch to a different one?
Rio, thank you for that question. That's a very good one. Which again, the scientific community cannot give a definitive answer. But what we know right now is that in general, the studies have shown, the studies were done on one vaccine, right? And so if you get the first dose Sinopharm, you get the second dose Sinopharm, first dose AstraZeneca, second dose AstraZeneca. And so the recommendation would right now, without further evidence, is that you should try to get the same vaccine for the first and second dose. Okay, that's the safest way to go. Now, that being said, there are being studies done now. There are some studies being done in England, looking at first dose AstraZeneca, second dose Pfizer, BioNTech vaccine. And so far, so good. It's shown that the amount of immune response, remember, measuring those antibodies is very, very high, actually even higher than 2 doses of AstraZeneca. So it's encouraging. It's encouraging that it seems that if you do this, what's called mix and match of vaccines, that it may become a very good thing. So I think that my prediction is that, it will come. But right now, the data are not there. We don't want to get ahead of the data in terms of our practice right now. So I was just asked this question by one of my colleagues about somebody who had gotten Pfizer vaccine from another country and was here. And should they they can't go back. So should they get the AstraZeneca vaccine? I said, no, there's no data to guide you. I wouldn't do it right now. And why do I say no? Why am I so cautious about it? Because we want to be data driven, right? We don't want to just go off and do our own thing. We want to make sure that what we're recommending is known to be safe. And that's the message that needs to be gone out to everyone, that even with all the vaccines, that's how we've done it. We haven't just started spreading vaccines to everybody without having strong data to recommend its safety and efficacy. So we're not going to go ahead of the data and say, yeah, I use AstraZeneca, then use Sinopharm, then they take a third dose of Pfizer, then take. No, we don't do that. We say stick with the data, because we know that we don't know what we don't know, right? So it's possible that if you mix them, something might happen. We don't know right now. So we need to wait for the data to make that kind of a determination.
That's interesting what you just mentioned, Dr. Hong, because I also know somebody who had their first jab here in Namibia, traveled to the United States. They actually consulted the CDC in the United States, inquiring if getting a different sort of jab, because we don't have the same type of vaccines, would be, good or not. And they said that, no, it's absolutely fine. So she continued to get 2 doses of a different vaccine on that side. I just want to make sure that I heard you correct when you said that sort of this cocktail of vaccinations, if you do happen to mix and match for whatever reasons, is that a good thing or a bad thing?
Right. Again, so mix and matching, it's not known. The data are not conclusive right now, but I'm optimistic that it will be something that will be shown to be fine. Now, I can't speak of the person that went to the US, and in medicine, actually what ends up happening, medicine is part science and part art, actually, because I practice clinical medicine as well. And sometimes there's situations that go outside of guidance. And so there may be some peculiar reasons why that person's doctor would have recommended getting an mRNA vaccine. That's fine. But the general recommendation is that right now, it's not recommended to mix and match vaccines.
All right. Well, Dr. Hong, I just want to ask before I continue, if you've got probably an extra 10 minutes, I've got 2 or 3 more questions to ask you.
Sure, yeah, I'm fine.
Lily from Facebook just posed a question, and she wants to know, can a person who's been on 3 months immunity be reinfected and get sick? I think you did answer that and say that if you're exposed to a different strain, then yes, but the chances of them getting severely ill from the same strain you had COVID-19 from is quite low, but you can just clarify that. She also wants to know, does immunity mean everyone around you is safe, and what happens if the 3 months then lapses, the 3 to 6 months that you are naturally immune, do you then become a risk to others? That's a question from Lily on Facebook.
I'm not sure if I totally understand the question, but it seems that what I got from that was, if you've been infected and you recovered, and you're immune for like 3 to 6 months, after that, are you not immune and are you a danger to people around you? Is that the question?
Yes, that's basically the question. Like, once your immunity lapses, do you then become a danger to those around you? And also, if you are in this window period where you sort of considered it safe with your immunity, your natural immunity, can you get reinfected with COVID? And I think you did respond to that question earlier where you said, if you are exposed to a different strain, then yes, you can get COVID again within that 3 to 6 months period that you consider to be immune. But the chances of getting COVID of the same strain is low. That's how I understood it, but you can clarify.
Yeah, I mean, natural immunity is pretty good. And reinfection after natural immunity is rare with any strain. I would just say with a different strain, probably the risk is a little bit higher, but it's pretty good. We don't know how long it will last, and that's why we do recommend getting the vaccine. Why should you get a vaccine after natural immunity? For 2 reasons. Number one, it will make your immunity last longer. Number two, it will broaden your immunity so that if there are different strains, you will be better protected. So that's why I would highly recommend people who have been infected and luckily recover, that they do get vaccinated. Also, just to add, there has been some data that has been kind of coming out, and it's not definitive yet, but some suggestion that there are cases where people have this post-COVID condition or long COVID, which we talked about. Some of them seem to actually get better with vaccination. Now, that's not conclusive. I just say there's maybe some pointers to it, but it's not absolutely known yet. So a person who has been infected and then recovered 3 to 6 months later, are they a risk to people around them? I think they're less risk because it's kind of like they've gotten 1 dose of vaccine because they were infected and got better. And so I would say they're less risk, but if they want to not be a risk really to people around them, I would say get the vaccine so that they could protect others around them.
It's going back to what you said about not having enough data right now to support whether or not a cocktail of, vaccines would be a good thing or not. That data probably could have helped us currently, because as we know, the country has run out of the first shot of Sinopharm. So if you did get Sinopharm and now you can go for AstraZeneca, that probably would have been helpful. But I just want to know, with the country having run out of this first shot of Sinopharm, what does this mean for the collective, the general public, and also how does this affect the efforts of the stakeholder?
Yeah, I actually don't know if that's true, Nina, but I'm not the one to speak about that. Honestly, you'd probably have to ask someone in the government. So it's hard for me to make a comment on running out of Sinopharm. But one thing I do know is that we are expecting 150,000 doses of Sinopharm to come in the next week or two. So I think that's really a real cause for celebration and hope. 150,000 additional doses of Sinopharm should hopefully be coming in the next couple of weeks. Also, let me just add, if you've gotten one dose of Sinopharm, you're supposed to come back in like 3 to 4 weeks. I think in Namibia it's 4 weeks to get your second dose. If you're like a week or two or a month late on that second dose, your body is not going to forget that first dose. So I wouldn't worry about it or be stressed. I will continue to keep myself protected by masking, distancing, good ventilation, hand hygiene between that first and second dose, and then get that second dose when you can. We've seen that in terms of some of these vaccines, especially AstraZeneca, good data, the longer the interval between that first and second dose seems to afford higher protection. And that's why Namibia started off saying 12 weeks between that first and second dose. Why wait so long? Because some of the data show that you get better protection if you wait longer. So we don't have the data for the other vaccines to show that, but it's very likely that if you wait longer for that between that first and second dose, it may be helpful in terms of your immune protection. So, but the main point is, it's okay. You don't have to stress out if you're a week or two or even a month late. Your body will not forget that first dose, so you'll be fine. Just get it when you can.
In relation to what I said concerning the first shot of the Sinopharm having run out, that was actually headline news in some of our local papers. So I don't know if you had seen that, did you?
Yeah, I've seen those. To be honest with you, there was some potential miscommunication about that in the papers. I think there was some communication that one of the regions had run out of it, but the country definitely, I don't think the country has run out of Sinopharm. I think what they're doing is they're, like some places may have run out, but others didn't have more. I think they're redistributing the vaccine so that it's everywhere. And so there's no region that's running out. That's my interpretation of it. I don't really think that the whole country has run out, but I'll leave that to the ministry to make a definitive call on that.
All right. I think we can start rounding off. So just before we end our conversation, the ministry is also trying to procure a wider range of vaccines. From one of the earlier Ask the Experts conversations I've had with them, they're looking into getting possibly Johnson & Johnson. I'm not so sure about the Pfizer, but you mentioned it early on in our discussion as well about new vaccines coming in July. Tell us, everything you know about these efforts.
Yeah, so from what I know, and this was reported by the minister, I think the day before yesterday, we have AstraZeneca coming in, the same vaccine that we have, a good supply coming in soon. That's good. Sinopharm, what we're using, that's coming in. And we also have the Johnson & Johnson vaccine, which is it's very similar to the AstraZeneca. It's an adenoviral vector vaccine. And so very similar to the way that AstraZeneca works. So, but the good thing about the Johnson & Johnson vaccine is that it's one dose. The other vaccines are all 2 doses, essentially. But the Johnson & Johnson one is 1 dose and you're done. So that's kind of a good plus. That one, I think, is coming later, like in August. And I would highly recommend that one. That one has some good data supporting its use against the variants. It's good efficacy against South Africa variant. So I think that's very good. Incidentally, the AstraZeneca vaccine has been shown to have very good efficacy against the Delta variant with 2 doses. So I think we're in good shape with that one, and we should continue to have people get that vaccine. Those are the ones that I know of. There may be other ones in the horizon. I think we will get more vaccines and in much larger supply. So please be hopeful about that.
Fantastic. Another question came in from Eduardo Naikaku. Eduardo says that my understanding is that vaccines introduce the virus to your body so that the body can react to that pathogen and create antibodies. I also understand that one doesn't become immune from COVID after the vaccine, but reduces the possibility of severity. Now, I, having had COVID in the past and having beaten it with the help of home remedies, doesn't it now mean that I also have naturally generated antibodies, the very same ones I could get from the vaccine, and they will equally protect me from severe COVID-19 effects? Is it then still necessary for me to get vaccinated? Also, please clarify the differences any between naturally generated antibodies and those triggered by vaccines. And lastly, there's unconfirmed information that naturally generated antibodies don't last in the immune system, whereas vaccines generated antibodies last. So please clarify. Eduardo, Dr. Hong actually answered all of those questions early on in our conversation. We are coming to the end of the conversation now. So please do us a favor, and I think by tomorrow, this conversation will be up on the NMT YouTube page, so you can get the answers to your questions there. You can just also go on YouTube and then click in hashtag Ask the Experts, and this interview and previous ones will come up. I also want to encourage everybody to keep sending their questions to info@nmt.africa, and then we'll see how we can get the necessary answers from our experts, because this is a monthly platform that's made possible to the public. Any COVID-19 related questions you might have, around the virus, around the vaccine, please send them through to info@nmt.africa, and we will try to get them answered as often as possible. Dr. Hong, just before I say goodbye to you, any final words of wisdom and advice you want to give Namibians?
Nina, thank you so much for having me on this program. I think it's really great what you're doing here. I think just giving people an opportunity to ask their questions, it's really, really huge. And having a forum for it and good answers, hopefully. And so I guess for me, the last thing that I would say is that we should actually be very thankful to have the vaccines. I'm extremely thankful. About a year ago, we didn't have vaccines. We only had COVID-19 and lockdowns. Nobody likes lockdowns, and we didn't know where we were going to go. Nobody thought we'd have all these, one vaccine actually that would work so well, let alone multiple vaccines that have been proven to be safe and effective. And so I'm just personally very thankful to have these vaccines. I've been vaccinated fully. My wife has been vaccinated, and we're so thankful for this added level of protection. Now that we have these vaccines, I think really it's the public's responsibility to not only get them, but to get the word out for others to get them. Why do I say this? Because vaccination is not just about protecting ourselves, it's about protecting others. It's because if you get infected, you may not know, and then you'll spread it to somebody else. You may get better. I hear young people saying all the time, but I'm not going to get sick. I'm going to get better. But then you may pass it on to somebody else, like your mom or your grandma or your uncle, and they might die. How would you feel if you were the one who passed it on to them and they died? I really feel like it's our social responsibility to get vaccinated, not just for ourselves, but to protect other people, our family members, our loved ones, our neighbors, and people around us. We're supposed to love our neighbors, right? We're supposed to love one another. And so I think and serve one another. I think this is the way that we do it. We really get vaccinated for the sake of other people. And I feel very strongly about that. And not only that, for the whole world community, we all need to get vaccinated. It's being said in different countries that are well vaccinated, nobody is safe until everyone is safe. It's true. Because of variants. The more that the COVID-19 is spreading and replicating in the community, the more chance of another very bad variant will arise. And the very bad variant that vaccines will not work to. So I think it's important that we as a community really come together and get the word out. We all have a responsibility. It's not just for the ministry to do anymore. It's about everybody. Talk to another person. Please get vaccinated. Answer the questions, but don't just ask the questions. If you ask a question and it get answered and now you know the answer, go answer that question for somebody else and be part of the solution and not the problem. I just feel like I've been in this country since 2009 and I know Namibians. And I love Namibians because I think they're just really warm, giving people. And what I fully expect to happen is that the country will come together and they will really help one another to get vaccinated. Thanks, Nina.
Well, thank you so much for your time, Dr. Hong. It was absolutely lovely speaking to you. It was very informative, even for myself, and educational. So thank you so much. And it's so true what you say, that nobody's safe until everybody is safe. On that note, we've come to the end of this hashtag Ask the Experts session. My name is Nina Katangana, and until next time, it's goodbye. Thank you so much for everybody who tuned in.
Thank you.
The Ask the Experts platform is a monthly segment that offers an opportunity for Namibian journalists to engage noted experts in one-on-one discussions on the COVID-19 pandemic. Journalists get to pose questions to experts in various sectors to ensure that they are equipped with the necessary information to better inform their readers, listeners, and viewers. COVID-19 is our common enemy. Together, we can defeat it. Proudly brought to you by the Namibia Media Trust and the DW Academy.